Good evening and welcome to tonight's Medtronic Diabetes webinar. Tonight we'll be talking about active lifestyles and insulin pump therapy. Joining us tonight are our two guest speakers. From an HCP perspective, diabetes educator Sally Double, and from a patient perspective, Jason. My name's Dean Kanakis. I'm part of the Medtronic Diabetes marketing team here in Australia, and I'll be your guest host for tonight. Just a quick clean up before we dive into it, guys. If you are planning to submit any questions during the live event, please feel free to reach out to us through our Facebook page. That's Medtronic Diabetes Oz, or through the hashtag on Twitter, 640G webinar. Okay, so just to do a quick introduction. Sally is a credentialed diabetes educator at the Melbourne Diabetes Educators. A 25-year-long career in healthcare, Sally was driven to specialise in diabetes. Her passion is to educate and support people managing diabetes, with special interest in insulin pump therapy and successfully balancing diabetes with sport. Thank you for joining us, Sally.
Thank you for asking.
Okay, so over to Jason. Jason is an insulin pump advocate for Medtronic. He was diagnosed at 16 years of age, a week before his 17th birthday. He's always had a passion for exercise, and in his late teens, Jason developed an interest in endurance exercise and road cycling. When his diabetes educator heard about a failed marathon attempt, she let him know this could have been from poor diabetes management. After being convinced to attend an information event, Jason learnt more about pump therapy and began using an insulin pump shortly after. Thank you for joining us, Jason.
Thanks, Dean. Glad to be online, mate.
All right. So we'll dive into the questions now. So our first question is for you, Jason. What were your initial concerns with wearing a pump and exercise, and how did you overcome these concerns?
Yeah, my initial concerns were probably about, and probably more related to my general concerns with moving from multiple daily injections to an insulin pump, really around how would it affect my movement, where would I put it, how would the site handle things like sweating. Really, I guess what I did was jumped in and just, it's really like anything, a lot of trial and error. So I moved things around, and I eventually found, I guess, happy places for both the sites and for the pump. Luckily, I think with events like now with cycling, lucky in that the upper body remains quite still. So I have found that it has been really no issue with having the pump on and using the pump even when I was running. Through trial and error, you do find things that work, and there's no one size fits all for every event, for every person. There is so many different options and different ways to handle it and to do it that I think I've found many that work for me, and I'm sure other people in similar situations again do probably something different, but what works for them.
Thank you very much for that, Jason. Sally, over to you. Are there common issues you see with diabetes and exercise, and how have you seen insulin pumps overcome this?
So I think initially the first common issue that I see with when people start exercising is that they actually see huge variability in their blood glucose levels. So a lot of people get completely frustrated because they have trouble identifying how they actually deal with swings and roundabouts associated with their levels. So I think that often deters a lot of people from exercise, and it often deters a lot of people when they're trying to get into a new exercise because they just can't get their heads around, how to manage it. So is the first concern, and probably the second one, if I was going to label sort of two major ones, would be a lot of people run their levels quite high pre an exercise due to the fear of actually dropping too low or having hypoglycemic events, which means they have to pull out of events, which a lot of people don't want to have to do. So once they've decided to exercise or go out and do some fun sport or something that they're enjoying doing, they really don't want to pull out of it. So they're probably the two major concerns I see. How do you deal with that? Well, I guess with a pump, the great thing is that you're only dealing with one type of insulin. So a lot of people can then get their heads around working with one type of insulin, how it's active for them, how long it influences their levels for, so they can get a better feel for how they can then balance their activity or their exercise that they're doing. On top of that, I think that the pump has a lot more features that you can react quickly to variability in your levels. So you can put temporary based rates on, so basal referring to decrease or increase your requirements depending on what that particular activity does for you. You can give really small increment deliveries or really small doses of insulin, and that can really assist people, so that they're not having big doses. And you can do that just prior to exercise, just after exercise, particularly if people are finding that they're having quite high levels depending on the type of sport they did. But as Jason said, there's so much variability depending on the person that I think it's really about catering for their needs, and we have to be mindful of that.
Thank you very much, Sally. Guys, just a quick reminder, if you have any questions while we're live, please feel free to reach out to us through our Facebook or Twitter account. Okay, now for the next question, over to you, Jason. Yeah. So Jason, has there been a change in your performance during exercise from when you were on injection and now that you're on a pump?
Yeah, there definitely has, Dean. It was a few years ago for me now that I did make the change, and exactly what Sally just described is where I was, especially from a racing point of view. So training, I didn't have as much fear associated with, well, what are the impacts if this doesn't go well from a performance point of view. Now, I was happy to, less fear, and I was happy to, I guess, run things as I normally would, a lot closer to what would be a healthy and therefore optimum performance type of sugar level. However, what I was finding, and I guess as you mentioned in my intro around a failed marathon attempt, and that was one of many at the time, what would happen with me is obviously I was using the typical multiple daily injection basal bolus regime where I'd have a big dose of an insulin like Levemir or Protophane or Lantus the night before. What I would do the night before the marathon is, so going into it, obviously I'm having a whole lot of carbohydrates to load my body with carbs for that big endurance event. I would then the night before, out of fear of the next day I'm running a marathon, I don't want to have this big dose of basal insulin, which I found was unpredictable. To get away from that, I would cut that right back and accept that my sugar level may be a little bit higher than normal on race day before we started. I'd do that. I'd then also get up, I'd eat again in the morning, and I would cut back the bolus injection as well. So I've backed, as Sally said, I've backed everything off out of the fear of, hey, I've trained for this thing for months. I'm not having, I guess it wasn't fear of pulling out. I didn't want to stop for 5, 10, 15 minutes treating a hypo. That just wasn't acceptable. You're not training to do that. So what I would then find is I was finishing these events with sugar levels of 27, 28. And the feedback I was getting was that my results were not reflective of the, what I was doing in training. So that is what eventually led me to investigate insulin pump, and what ultimately led me to doing that. And we'll probably talk more later about what I actually do. And as Sally said, I use the temporary basal function with an insulin pump a hell of a lot every day in training and in racing, before the event, during the event, after the event, also sometimes doing all three of those in training. That means that I now go into those events with a lot more confidence with how I'm controlling it, and my sugar levels are a hell of a lot better during the event. And so therefore, as we know, I'm not a doctor, but as I know that when your sugar level's high, it's a whole lot of sugar or glucose in the blood, and not being able to transport that energy into the working muscles where you need it. I guess with a better sugar level, more optimum, I'm able to transfer that energy out of the bloodstream into the working muscles, and with sport you therefore perform better. So absolutely, my performance improved greatly when I switched to a pump.
Thank you very much, Jason. Okay, over to you, Sally. Before my race, I'm quite nervous and experiencing an adrenaline rush. Can the pump help me manage my levels during?
This is such a great question. I think what we find with many different sports and different activities is there can be a lot of influence to do with other hormones. And often people describe a huge elevation in their levels, particularly prior to competing or a race-based event, which is what this question's about. I think what we have to remind ourselves, though, is that everybody does respond differently to different activities and different hormonal responses to do with nerves. So I think it's really important that people develop a team response when they're going to, implement basic changes to do with their activity. But generally speaking, I'm going to say, well, yes, I think a pump that would help being able to deal with this. And the pump, you can actually set different basal or background rate patterns to suit different days. So a lot of people when they train, as Jason said, have different requirements when they train as to different requirements when they actually compete. Because when you compete, the body secretes all sorts of different hormones, and there's a lot of fight and flight based hormones, and often they can cause a huge elevation in people's levels. So being able to use a pump, you can actually, before you went to bed the night before, you can set a different background pattern or basal pattern where you can deliver a much higher rate for a few hours prior to actually doing your event that can hopefully curb that rise that you get from the adrenaline rush, and then come back down onto much lower rates to get you through the event without actually, you know, having an event where you drop too low or have to treat. So people find using background or basal adjustments a lot more predictable when they're competing, because bolus-based insulin or injectable, you know, insulin in one big bolus, often people find that very hard to predict based on activity levels and how they're going to get through a long event. So I'm going to say yes, I think a pump would help being able to deal with that, but you've got to work with people on how you can set certain settings to be able to address that.
Thank you very much for that, Sally. Okay, back over to you, Jason. Do you find it uncomfortable having the infusion set under your skin while exercising?
No, I don't. I guess what I've had when we talk about exercise and side issues, I've had very, very few. I guess as I said in the opening question, it's about finding what works for you, and different things work for different sports. As a cyclist, I don't typically use, or don't, the typical side that people use on the front of their stomach, you know, beside their navel. I don't use that. I use the sort of the back of my hips, you know, further around laterally, because of, if you imagine a bike rider on a bike, you know, I'm hunched over, and I found when I started doing this, I would, you know, that puts pressure on that area, that moves a little bit. I was finding that they would eventually, I may lose that site there earlier than you should. Moving them to the hips, a lot more of a stable area on a bike. It's away from any of the action zone really, and I've had no issues since doing that. That for me, but I've had no issues really with feeling it under my skin. I did have at some points when I was, you know, if I get extremely lean, you know, and got a low body fat percentage, I did find that, you know, occasionally I was kinking a plastic site. What I did during those periods, you know, well, there are, like I said in the beginning, other options. I moved to the steel cannula for that, and that, of course, I'm tough, but not tough enough to bend the steel, and that was the solution for me in that circumstance.
All right, thank you very much for that, Jason. Yeah, back over to you, Sally. I currently undertake strength training with heavy weights, and I use pens to manage my diabetes. How would moving to an insulin pump help me?
I think what the insulin pump would do, as I said earlier, is the insulin pump only use one type of insulin. So you've got your rapid-based insulin, which is delivered in as a background every hour. There's a small amount delivered depending on the person's requirement, and then you deliver more depending on what your blood glucose levels are and what you're eating. So yes, a pump allows greater flexibility when you're dealing with variances to do with weight training, whether you're dealing with, you know, long distance-based activities. I mean, I'm bringing a lot more other sports into it, whether you're dealing with just sporadic things such as whitewater rafting or canyoning or any other bits of activity that you're doing. But I think often people find when they do intense exercise, they do find that often they have an elevation or a spike in their blood glucose levels directly during and directly after these types of sports. So and then obviously because the muscles are then really hungry to replenish some of that glucose later, people find that they often drop low or have much less insulin requirements later on, and it can be many hours later during that. So what people find with an insulin pump is that you can again use small increment bolus doses to deal with elevated spikes in your levels. You can also deal with delivering higher background or basal rates a few hours prior to those particular events to try and curve that response if you've identified that. And on top of that, you can also reduce basal rates post your activity level, which will then prevent you having to eat more to keep your levels up. So a lot of people really enjoy the fact that they don't then have to eat for their activity. They eat really for their training regime, not for the fact that they need to keep levels at a particular stage that. So pump therapy will be of great benefit with that flexibility to deal with those variabilities that people get with those sort of trainings.
All right, thank you very much for that, Sally. Guys, just everyone at home, a quick reminder, if you've got any questions, please feel free to post on our Facebook page, Medtronic Diabetes Oz, or using the Twitter hashtag 640G webinar, and we'll try and squeeze them into this session. Okay, so over to you, Jason, for our next question. Oh, nice. Just a small technical difficulty with our slides. There we go. Okay. All right. So, Jason, where do you put the pump when exercising, and do you find yourself having to make adjustments on the pump a lot during exercise?
Yeah, so on a bike with a cycling jersey, obviously I'll put it in one of the 3 general back pockets you have on a cycling jersey, so that's really been no issue for me. I guess the other key thing to identify is, depending on the length of the session or the race, sometimes I'll take it off entirely. So I've done, for example, I've done some track cycling where the events are very, very short. You're wearing a skin suit for that. When I'm off the track in between the events, I obviously have it on. So, and when I'm racing, for a couple of minutes, I don't take it out on the track at all. So, and I've done that for events up to an hour, and sessions up to around an hour. I'll have insulin before, a bolus before, and I won't wear the pump at all. So it's not always connected, depending on what you're doing and the length of what you're doing. With regards to adjustments, typically no, and I guess, again, early on, yes. When I first started using a pump and working out how this works and how my body responds to different kinds of sessions, right to, as Sally said, from heavy strength-based stuff requires a different set of rules, so to speak, as to the 6-hour ride on a Sunday. They're different. However, I also use a continuous glucose monitor, so therefore I've got that 24/7 information, which means out on the bike I'm going to get an alarm if I do need to make an adjustment. So sometimes I do respond to that info, and if things are climbing, I will have some insulin. If I've pulled up and we're eating, and then after that it's rising, I will have a unit or 2. So, but generally no. After years of doing very similar things, I know what temporary basals I need beforehand and during, and likewise I know what bolus to have with how many carbohydrate I'm having beforehand. So I've really got for me now, it really is autopilot. Depending on what I'm doing and what day it is, I know what to punch in, so I don't make a lot of adjustments on the fly anymore.
All right. Thank you very much for that, Jason. Okay, over to you, Sally. I regularly switch from low to high intensity exercise. Can I still do this with a pump? And would it be difficult to make adjustments for these changes?
Okay, I think exactly as Jason has just said, every different activity is going to require different assessments of what you're doing. Sometimes, as short burst activities or even your contact-based sports, your pump will be off. So people do take their pump off for short periods, so long as they understand how they're going to implement insulin dosing appropriately to cope with those particular situations. So that can certainly happen regardless on what sport you're doing. So there's a lot of people that do football, basketball, any of those contact-based sports who, when they're actually competing, will take their pump off for those short games. And then you've got people that do Ironman, or you've got long distance, or other just canoeing or rowing, and they'll actually keep their pump on for that period of time and adjust rates depending on what they need. Jason's got the benefit that he's using continuous glucose monitoring with his pump. There's a lot of data that you can actually collect when you're really trying to analyse what sports are doing what to you, how you might make adjustments, what are the best ways to do that, so that down the track you can go a little bit on autopilot because you know what generally works for you, 95% of the time with any of your activities. The other thing that I think is of huge benefit when you're working with a team to try and identify what you do with your different activities and what sort of foods you could eat pre or post, or what sort of doses of insulin you can have. All these pumps contain a lot of data, and a lot of data that can be uploaded onto software that you can then interpret yourself, interpret with the help of your endocrinologist, your educator, your dietitian, whatever support team you have, that you can then develop all sorts of strategies to deal with high intensity exercise, low intensity exercise, long distance, short distance, sporadic exercise, if that's the other thing that we need, just purely because of the fact that you've got the flexibility to adjust. information and a lot of data. So I see moving to pump therapy certainly a really positive way for really active people, if that's the decision that you want to make.
All right, thank you very much for that, Sally. Okay, back over to you, Jason. How did you manage the lows after exercise went on pens, and how do you find the process now that you're on a pump?
Yeah, so I guess it's very, very similar. You know, a low is still a low. The symptoms are still very much the same. I guess the key thing I did then, and I still do now, is be prepared. So what I always have on me, and this is really just to eliminate the fear you can have when you are low and don't know where you're about to get some sugar. I generally always carry, or have nearby, sugar sachets. So generally what people are throwing in their coffee, I've got in my pockets on hand. The process is very, very similar. I've found the key difference I found from pens to using a pump is really the fact that you haven't got the long-term basal insulin on board, so you're always using just a short-acting insulin. What I found, it gave me a lot more predictability with how your body responds to treating a hypo. So and I'm not sure of the science behind this, but what I did find with using an insulin like Levemir, it's almost like there's this weight in your body all day that seems to hold you down a little bit longer when your sugar level's low. With a short-acting insulin like Novorap, for example, I found that the response or the treatment for a low is a lot more predictable, and I found a lot quicker is the key difference. But before pens, after pens, for me, the treatment of lows has been really the same.
Right, thank you very much for that, Jason. Now back over to you, Sally. I'm currently training for an event and on injections. If I decide to change to a pump mid-program, will I need to stop training, or is it better to change to the pump and continue my normal training load as that's my normal lifestyle?
Great question. So I think, again, it's completely individual. Certainly I've had many people that do a lot of training that have actually decided to trial a pump due to the fact that they believe that will improve their performance and their flexibility, so that's the rationale behind it, and they've usually got a target in mind. So, they might be considering an Ironman event that's in 6 months' time, or, a cycling event or a rowing event, whatever, regatta, whatever that might be. I actually usually say to people, the more variables in the initial, week that you can cut back to do with trying to get most of your settings reasonably accurate most of the time is always of great benefit. But in saying that, I wouldn't say you have to stop your training. I'd probably say, could I have a couple of days of light training, perhaps, when you first transition onto your pump, so that at least you're still getting some training in there, because that is your usual lifestyle. But I might try and prevent the really variable things that you might do that might cause huge spikes or changes in your levels. Or I might indicate to you, please don't exercise late in the afternoons, just because I want to get your overnight rates correct first. And often we find late-based exercise can have a big influence on your overnight rates and what your settings need to be. So I would say to you, no, you can continue to do your usual lifestyle. Maybe try and keep your food intake of foods you identify and and you understand, and don't go out and have, maybe a big load of meat pie and chips or something at the footy the day before, or something to that effect. So at least you've got some control over that variability, which we all know food still varies things hugely with your requirements. But I'd still say training is certainly possible, and we can work around what that is as your usual requirements.
Thank you very much for that, Sally. Guys, just another quick reminder out there, if you do have any questions, please reach out to us through our Facebook page. That's at Medtronic Diabetes Oz, or through using the hashtag 640G webinar on Twitter. Okay, next question. Over to you, Jason. Outside of exercise, how many hypo events do you feel now?
Yeah, this is a really good question. One I get asked often, and unfortunately there's not really a textbook answer to how many hypos you get. And I think any type 1 diabetic probably would appreciate that as the answer, because and it's a question I think sometimes health professionals will ask, well, how many hypos do you get? I wish there was an answer and I could say, well, it's 1 week. It's unfortunately there's not. It really depends on what I'm doing, what's happening in my life, the stresses, the general lifestyle factors we all have to deal with. That influences. I don't have a lot of severe hypos. It's been very, very, very long time since I've had a proper severe hypo. I'm talking really about the times here I need to treat the the 3 to 3.5 sort of events. I do have the benefit of a CGM. I get some early warning of that and can generally pull things up before I'm dealing with much below a 3.5, which is a great benefit. I guess it comes back for me to being prepared, accepting that there probably is no textbook answer to that question. What you do find though, I think it's basic science. If you spend more time at 5, you generally, you may have a few more lows. What I find is the roller coaster is what causes the lows. It's the highs that sometimes cause the lows. So you get really high, you get really, oh, I want to get this down, I want to get it down now. So you get a whole lot of insulin into yourself, and then before you know it, 2 hours later you're low, and then you're in the fridge, you overeat, 2 hours later you're high. Getting off that roller coaster, I found, does lower the frequency of lows. So it's not just about the lows, it's preventing the highs, I found, to prevent the lows. Stability, for me, creates that environment. And an insulin pump, for me, has created that, a lot more of a stable environment with my sugar levels. So I probably do have less lows. Some weeks, though, I definitely have a number of lows. That can be life as a type 1 diabetic, I think. And an insulin pump provides amazing flexibility for your lifestyle. It's not a cure, though.
All right, thank you very much for that, Jason. Okay, back over to you, Sally. Have you had many patients report of hypo events once they have commenced on insulin pump therapy?
Gosh, it would be really great, as Jason said, if we could eliminate that. But I think part of managing type 1 diabetes and the balance of all the variables that go with it, really, hypoglycemia is still apparent. But what all the technologies are looking towards are looking to try and reduce that people have to do in relation to low levels of hypoglycemia. So people do still experience hypoglycemia on pumps. Less likely is the if people are combining that with continuous glucose monitoring, because often now we've got technology that can help prevent that or alert the person to that prior to actually having a hypoglycemic event. So that's made a huge positive impact on some people in relation to that, if they've got the ability to wear that as well. But I think, as Jason really pointed out, I think once it's trying to get off the roller coaster, because he's absolutely right. I think when you've got huge variability in your levels, that's often when people lose the ability to really understand how their body's responding, and often they'll find hypoglycemia does creep up on them a lot more, and when they're elevated they want to get that back down. So of course the aim is to give more insulin to do that, and often overcorrects that. So I'm going to say no, hypoglycemia doesn't disappear, but I think because they often respond really well to just small treatment of in glucose, because they've only got the one type of insulin to use. So I think that's a huge benefit for a lot. And then being able to analyse data, or have healthcare teams and support being able to analyse data off software that these pumps, you can upload all this data, can often detect where the hypoglycemia is occurring and how best to treat that and how best to potentially change settings to help prevent it or eliminate it. So I think that it's still there, but I think the improvement or the reduction in it, a lot of people say that they believe that that has improved a little bit. But I think when you're combining exercise as well with type 1 diabetes, and particularly new-based exercises, a lot of people find that they deal with a lot more hypoglycemia as their body's adapting to try and work through, how their body responds to these types of activities. So I think just stick with it. If you've got a new activity, your body adapts to that, and once you can work through it, you will actually get through with less hypoglycemia.
Thank you very much for that, Sally. Over to you, Jason. So what would you say is the best advantage to using this pump over other therapies?
Yeah, it's a word we've probably used a fair bit tonight. I think it's flexibility. So ultimately, when you boil it all down, what you can do with an insulin pump is, if you need to and want to during the day, you can have 10 needles if that's what you need. No one really, I don't think, no one wants to have 10 needles for real during a day. I think that's just a very human part of it. So, for example, going out to dinner, for example, is a really good way, just generally even away from sport, to highlight the flexibility. You sit down, you order, you've then at that point got no idea normally when that first entree is going to turn up. So what do? Do you have your insulin then for your anticipated whole meal, a 3-course meal? What you can do with an insulin pump is you can have that when the entree turns up. You can then have more when the main turns up, and if you choose to have dessert, you can make that choice then and have more right then, and that would effectively be 3 needles for people who are on multiple daily injections. That kind of flexibility it can be a game changer for people's lifestyle. It definitely was for mine. I've got a younger brother with type 1 diabetes as well. I moved to an insulin pump first. We were both very much in the camp of not moving at all, because we grew up in a family where every kid had type 1 diabetes, I guess. So we didn't want to be connected to something. He'd had it a lot longer. He didn't want to move to an insulin pump. He very quickly moved after he saw the things like that around our family dinner table. That combined with the ability to have, as Sally has said, only one insulin on board, and the ability to back that off when you need to, is really, really beneficial. When you're using, what I found when I was using a nighttime dose of a long-acting insulin, you very much, you say you're making that decision at 9 o'clock the night before, you're then tied to that decision the next day. What you've done at 9 o'clock the night before influences what you do that next day, and you can't go back and change that. You put that big insulin dose on board, and you're then living with that the next day. An insulin pump and a temporary basal, or the ability just to alter that basal as you need, gives you flexibility on the spot. It's something that turns up. From a sports setting, say you make a decision the night before about something you're doing tomorrow morning, and tomorrow morning doesn't turn out, it's raining, it doesn't happen the way you thought it would, it's too late. You've made that decision the night before. You've either got to have some more, it's a lot more difficult, whereas, it really, with an insulin pump, it's a press of a button to change that. So for me, it's flexibility.
Right, thank you very much, Jason. So back over to you, Sally, for our next question. What would you say to active people who are newly diagnosed with type 1 regarding insulin pump therapy?
I think insulin pump therapy is a therapy that's open to anybody that's managing type 1 diabetes. I don't think it really should matter whether you are just recently being diagnosed or you've been living with it for many years. It's an option, and I think people need to be made aware that it's an option on how you can actually manage your diabetes. When the person is ready to take that step, then I think that so long as they're supported by the correct team to get them through that, then I think that's actually possible for that. I certainly offer that to anyone that I meet, whether they're, as I said, newly diagnosed or whether they're, been managing it for years. It's an option, and I think people need to understand that you still need to make it work. As Jason has said, you've got to understand how this therapy works. You've got to understand how it is working with one type of insulin. It does create greater flexibility, and if that's what people are looking for, you can work through with many different features that the pump has, with all sorts of different basal rates you can set and patterns you can set, and you can capture events of whether that's exercise or food. There's all sorts of strategies you can put in place for sporadic-based activities, as I said before. Even if it's just that you want to go off a 7-metre waterfall on whitewater rafting, you can still do that. And you can do that with a pump, and there's ways around that. And as Jason said, for short burst activities, you can come off it. There's ways to manage all sorts of activities, and you can do that while you're still wearing insulin therapy. I think it should be an option that's offered to everybody.
Right, thank you very much for that, Sally. Guys at home, just another quick reminder, if you have any questions, please feel free to post on our Facebook page, Medtronic Diabetes Oz, or reach us through the hashtag on Twitter, 640G webinar. Okay, so over to you, Jason, for our next question. Okay, what would be your one piece of advice to someone thinking about making the switch to a pump?
Yeah, really good question. I'm going back to myself when I was considering this. What I would tell my former self, my multiple daily injecting self, would be just to take the next step. The next step may not be going onto an insulin pump. The next step is normally getting some more information. So I guess if you tuned in online tonight, you're probably doing that. It's do things like go and check out what it actually looks like, what it feels like, how it connects to you. what it means, I probably had a whole lot of preconceptions about being connected that were myths. My key message to people considering is just exactly that. Take the next step, get some more information.